How bad is the situation in India right now?
Out of 100 most polluted cities, 63 cities are from India. 9 out of 10 people in India are living in a polluted environment.
But do you think the government is doing enough?
Government is spending money on curtailing the pollution, so definitely it is going to make effect. Beijing was very polluted city 10 years back. The government invested in the efforts, made policies. So that is how the pollution has come down in Beijing or quite number of cities globally. The farmers are being blamed that they are burning the stubble and that is causing pollution. Definitely it is causing pollution. But why farmers are burning? So it is very easy to blame someone that farmers are doing this, but we are not going into the idea why those people are doing this.
Do you think these air purifiers, does it actually help?
Basically, indoor pollution we can curtail by these methods, what we are talking about, but outdoor pollution you cannot.
Pollution affect our lungs, heart, other organs directly?
From the portal of entry, it affects the neurological system, it affects the kidney, it affects the heart, it affects the metabolic system.
Hi guys, welcome back to our channel, and today we have a very special guest with us, and I have been looking forward to this conversation. Finally we are here. We are with Dr. Vitull K Gupta, and he is a very renowned doctor. He's done a lot of work for the rural and community healthcare. And doctor, I would love you to introduce yourself.
Thank you very much for giving me this platform to discuss an important health issues. I am Professor Dr. Vitull K Gupta. I am health and human right activist. So my passion is medical education and preventive health care. I am Chairman Association of Physicians of India Malwa branch as well as Lipid Association of India. So I am associated with lot of organizations. I am life member of about 11 national associations. I am a hardcore internist. So I am into almost all the branches of internal medicine. So that is what I am practicing now.
You've done a great job. It's our privilege to be talking to you today. So I would love to start from the beginning, how it started, your journey.
So basically, I got into medical college in 1978, and that is Government Medical College, Patiala. And I was a bit lucky. On very first day of my college, I was introduced to 3-4 of my seniors, including the great Dr. Gurpreet Singh Wander. And from the very first day, we had an association. Since he was a day scholar, so he used to guide us, study, along with me in my hostel. So that gave me a lot of learning experiences, because as a senior, now he is my mentor, my guide, my senior, my close friend, and he guided me through my academic journey, which after MD, he introduced me to Association of Physicians of India, Cardiology Society of India, and he helped me to get into the Executive Committee of Cardiological Society of India, where I was the only physician in their Executive Committee, and I was appointed the National Convener for Pollution Council of India by Cardiology Society of India. So I am member of Rheumatology Society, Indian Chest Society, so lot many other Gastroenterology Society. So we are now in a process to form the Punjab chapter of Lipid Association of India, CCDSI, RSSDI is already there. So we are working towards promoting academics among the doctors, especially in Punjab. So that is how my journey started in 1978, and with the help of a few seniors like Dr. Gurpreet Singh Wander, Dr. Karamveer Goyal, and lot many. So I have reached now that recognition at the national level is there. So recently we have published our third book. Previously we published on respiratory diseases, the COPD. Now it is on pollution and health.
Yeah.
So we have been doing the social work also during COVID. We converted our hospital into a free care center where we treated almost 200 to 300 patients. After that, we converted into a free vaccination center where almost 5 to 6,000 people were given vaccine. And with my few friends like Mr. Anil Pola, Mr. Sukhmeet Paseen, Kunal, Ashwini, we are into social service also. We organize camps from time to time. We have formed a Bathinda Citizens Forum where we take up the politico-social issues for betterment of Bathinda. So it is a multifaceted this with passion for medical education, preventive health care, social. That is why I write it as a health and social activist.
So like you can explain everything, very well to the audience. And coming back to Dr. Wonder, he was wonderful. We had a meeting with him. And for the viewers, you can see that podcast on our channel. He's a very well-known cardiologist. And so, Dr. Vitull, I would love for you to introduce us to your book.
Yes, this book we have published and it was released by Honorable Dr. Jitendra Singh. He is, quite great minister in Modi government. He released it on India basis. So we are
Okay.
distributing it free of cost. So it is 34 chapter book which introduce you to the effect of air pollution on each and every aspect of human life. So every organ is affected, every system is affected by air pollution.
Okay.
So it is
for the
available
viewers,
at our website, that is www.apimalwa.com, as well as our parent body website, that is apiindia.com.
so Doctor, coming to pollution, how bad is the situation in India right now?
So pollution globally is, has a concern, but in India, recently we were reading that out of 100 most polluted cities, 63 cities are from India. So 9 out of 10 people in India are living in a polluted environment. Pollution, climate change, global warming, they are all interlinked and affecting every living being, whether it is bacteria, it is plant, it is animals, or it is humans. So every living being is being affected. So that is in turn affecting the health of our planet itself. So it is a grave problem.
But do you think the government is doing enough?
So basically it is hard to say, because the what I feel personally, that the policies are made by the government and policies contribute to 80 to 90% of the problem solving issues. So if you can say that I am generating pollution, but that will be, if I am curtailing it, that will be a very minuscule amount as compared to the policies. So if government policies are there, government is spending money on curtailing the pollution, so definitely it is going to make effect. So we have few examples, like Beijing was very polluted city 10 years back. The government invested in the efforts, made policies. So that is how the pollution has come down in Beijing or quite number of cities globally.
So we are seeing like this artificial rain happening in New Delhi right now, for example, or the odd even thing that was introduced to curtail pollution. Do you think this all really helps?
So this, I think, evidence based, this is not going to help in a long way. Supposing today the pollution is more, you have artificial rain, the pollution level will come down for 3-4 days. Until and unless we remove, we control, or we eliminate the source of pollution, so these methods are not going to help much. Other aspect is the farmers are being blamed that they are burning the stubble and that is causing pollution. Definitely it is causing pollution. But why farmers are burning? Because it is not an economical viable substitute of burning the stubble.
Yeah.
So we did a very large survey in 2015, health effect of stubble burning, and that exposed, great evidence that more than 80% of the people are affected. Health is affected during those 20-25 days
Okay.
when the smoke is there in the environment.
Okay.
So we must have, conducive and applicable process to curtail that stubble burning. We should finance the farmers at panchayat levels, and still if somebody is burning the stubble, he should be punished very strongly.
But do you
But
think the farmers are to be blamed?
no, farmers are not to be blamed.
Yeah.
Economically, the farming is not considered to be an economically viable option. So we need to supplement their efforts and help them, give them devices, give them machinery, so that they are able to remove the stubble without economic cost.
Yeah.
So if economic cost is subsidized or given by the government, no farmer will be, because their families are also being affected. They are living in the area where lot of smoke is there.
Yeah.
So they are also sensitive. So it is very easy to blame someone that farmers are doing this, but we are not going into the idea why those people are doing this.
Yeah.
So if we have an answer to why, definitely we will solve the problem.
Hanji. But do you think rural India is dealing with pollution in a good way? Like in metros, a lot of these schemes and all are coming up. How is rural India like handling it?
Rural India is, catching up very fast with urban India.
Okay.
Whether you have non-communicable diseases, obesity, pollution, the use of internet, use of mobile phone, you can say pollution of social media also, and you will find, chips packet in remotest of the village.
Okay. Yeah.
So that is penetration of the social media and TV.
I remember my conversation with Dr. Wonder, even he messaged that chips, pickle papad are like really bad.
Yes.
And we just don't think about it in our regular life.
Definitely,
Yeah.
because Dr. Arun Gupta is there, who is promoting at a national level that front of packet labels should be warning labels, not grading.
Okay.
So, like in cigarette packet, you have written it is dangerous. So on food packets also there should be warning.
Do you think these air purifiers and wearing those N95 masks, does it actually help?
Definitely, the N95 masks are helping lot of people after COVID. So nobody is, has a stigma of wearing the mask. Before that, if we used to tell the bronchial asthma or COPD patient to wear the mask, he is going to say, "Okay, doctor, everybody will think that I have got tuberculosis," because only tuberculosis people was wearing mask. So definitely, if the environment is polluted, wearing N95 masks will go a long way. Whatever minimum, we can avoid pollution is good. Air purifiers are good for indoor pollution. So we divide pollution into outdoor and indoor pollution. Basically, indoor pollution we can curtail by these methods what we are talking about. But outdoor pollution you cannot, because it is environment which is, collectively we have to come out with the idea with policy making, and enforcement is very weak.
I would love for you to explain, does pollution affect our lungs, heart, other organs directly, or how does it happen?
So there are different mechanisms by which pollution is supposed to be affecting our health. So those mechanisms, basically port of entry is lungs. After lungs there is oxidative stress, there is epigenetic methods. So there are a lot of other mechanisms by which it is affecting our health. So those are all technical issues, but from the portal of entry, it affects the neurological system, it affects the kidney, it affects the heart, it affects the metabolic system. So name the system it is being affected, because it is basically targeting the metabolic system of the body.
Okay, it
So
slows
that
it.
is how, yes, that is how it is. So that is why the vulnerable group is children. It is growing stage. So those are being affected more. Pregnant females, again, female as well as the fetus. The upcoming child is also being affected. Elderly are affected. Poor and deprived section of the society, because their health is weak.
Could you explain it to us how doctors contribute to environment work and the society, like other than the medicine part?
Not much.
Okay.
I think everybody, a few environmentalist groups are there. They may have doctors as their members, but as such, like now the initiative by Cardiology Society of India to make a pollution council. But if you ask me, it is only on paper, not much in being done.
And in your journey, in your career, which has been your favorite part, or where you think you just upped your game, like?
So I think nobody can work without a motivating, inspiring, or you can say those personalities. So that personality I always quote is my father. So he has, lot of influence on our lives. And without the support of family, my wife, Dr. Sonia, is supporting me in each and every aspect, and you know, uh, conducting a conference, going out, working. And my daughter, Dr. Meghna, is got a best critic in my life, because this book would not have been possible if she has not gone into the details, minute details. So family support is there. I am very lucky to have great friends. So I am organizing the conference, and my non-medical, I used to call non-medical organizing committee, is working very hard. So with God's grace, so if you have good people around you, motivating people around you, so you can achieve.
Yeah.
But
You're a family man. I noticed that your wife is always supporting you, always there. I think that's a great thing. That's
yes,
how you recognize a person,
so
right?
family and good
Friends
friends.
is really important. So, doctor, you are organizing a MAPICon in Bhatinda in September.
Yes, so that
So,
is our 12th annual conference of API Malwa branch. So we are organizing this on 18 to 21st September in Bathinda. So that is a great conference, and a lot of, you can say, the national faculty has visited Bathinda over 12 years. Dr. Guleria was there, Dr. VK Behal was there. So you name any prominent physician or prominent doctor, they have visited Bathinda. And Mapicon is growing, again thanks to our organizing committee of doctors as well as non-medical friends. So we invite you all to register at www.api Malwa branch for Mapicon online.
yeah, even I'm really looking forward to September MAPICon.
Yes,
That will be great.
definitely.
So, at the end, doctor, we add a little rapid fire to make things light, just like a goodbye thing for our viewers. So, I would ask you pen or stethoscope.
And I will pick stethoscope.
Okay.
So because that gives you a communication or a patient oriented thing.
Yoga or meditation?
Not both. I will not.
No?
No. I will go for mixing of all the things: aerobic exercises, strengthening exercises, balancing exercises,
So, tea or coffee?
tea.
And any guilty pleasure of yours that you like to indulge in, like,
No.
no?
My father used, again I am mentioning my father. My father told me, don't do anything thinking that nobody is seeing.
Hmm.
Because in your heart, you know that this is wrong, this is right.
I would love to have more such
So
podcast
thank you very much.
interviews
In fact,
with you.
such platforms should give you, they build public opinion, they generate awareness, and lot many other people might think on those lines which we are thinking. So it is a great service by you also for recording, because generally the media don't like to record such type of, you can say, the views.
No, but it's so
So great
important.
revolutionary.
It's important. And I'm sure our viewers are very happy. Just like me, we feel privileged that we've understood so much today and we got great tips from you. And we wish you all the best. May you continue with your incredible journey. And so, thank you, doctor. And
Thank you
viewers,
very
if you
much.
liked our show today and you got some good insights and it helped you in any way, please like, subscribe to the channel Social Bloom. I'll see you guys soon.